Welcome to today's Explainer. Okay, so we are bridging a massive gap today between thousands of years of ancient wisdom and cutting edge health science. Have you ever wondered if the absolute latest in epidemiological research is honestly just catching up to what our ancestors already knew? Today, we're exploring the equilibrium of vitality by translating the ancient system of Ayurveda into the modern health capital model. We're going to map out how the core concept of health has remained exactly the same throughout history, but how the actual practice has been brilliantly adapted for our very different, fast-paced modern world.
I want to pose a question right off the bat, something to really chew on. What if modern health science is literally just ancient wisdom translated for today's world? It's a powerful thought, right? Both of the systems we're looking at today completely reject a reactive, disease-centric view. Instead, both frameworks, ancient and modern, embrace a process-centric view. Basically, health isn't a destination, it's an active, ongoing process. Okay, let's dive into our roadmap for this explainer. 1. Shifting our view of health. 2. Health as a cumulative asset. 3. Investing in your daily life. 4. Stress, the ultimate health disruptor. And 5. Adapting ancient wisdom today. We're going to translate these two massive frameworks using a super simple analogy today, a vitality bank account. Let's jump right into section 1, shifting our view of health, moving past the disease-centric model. Look, to really grasp this translation, we first have to agree that true health is so much more than just treating a cough or, celebrating the mere absence of a disease. True health is a living, breathing mechanism.
Let's start with the modern side of the equation, the health capital or HC model. This is a contemporary epidemiological framework. In simple terms, it relies on hard, modern data to define health not as some static, unchanging state, but as a cumulative stock of mental, social, and physical assets built over time. Think of it as a tangible asset portfolio. Every single day, you're either adding to this stock or depleting it based on your environment and the choices you make.
Now, look at how beautifully this mirrors the past. Enter Ayurveda, an ancient metaphysical and biological system. Ayurveda defines health as swastha. Swastha is a dynamic state of equilibrium involving your bioenergies, which are known as doshas, your digestive fire, called agni, and your bodily tissues, or dhatus. What's absolutely fascinating here is that even thousands of years ago, health wasn't just viewed as not being sick. The whole focus was on maintaining a dynamic, perfectly balanced internal process. And that brings us perfectly to section 2, health as a cumulative asset, the vitality bank account. This is where the structural logic of these two completely different eras just perfectly aligns. When we compare swastha on one side and health stock on the other, the translation becomes crystal clear. The ancient Ayurvedic concept of dynamic dosha equilibrium is conceptually identical to the modern HC model's health stock. Both systems are telling us the exact same thing. Your health is an accumulative asset. It's a bank account. It is constantly shifting, constantly changing, being depleted or replenished by how you actually live your life. So, moving to section 3, investing in your daily life, deposits over time. If health is a bank account, how do we actually build this asset? I want you to think about your own daily routines right now. To build that asset, Ayurveda emphasizes dinacharya, which is your daily routine, and ritucharya, your seasonal routine. These ancient practices were designed specifically to maintain an individual's constitution and prevent the accumulation of toxins, or ama. Fast forward to today, and the HSE model uses the term life course determinants. But guys, the concept is exactly the same. The HSE model explicitly states that healthy lifestyles are not just random, arbitrary choices. They are active investments that buffer our bodies against modern material deprivation and stress. The crucial takeaway here is the simple step-by-step process. Step 1, your daily routine, or dinacharya. Step 2, your seasonal routine, ritucharya. Step 3, healthy lifestyle choices, or HLC investments. Whether you're using ancient Sanskrit or modern epidemiological terms, these are the daily deposits you're making into your vitality bank account. You're actively building a buffer to protect your unique individual constitution. But what happens when we make withdrawals? Let's hit section 4, stress, the ultimate health disruptor. Because both of these frameworks, despite being separated by literally millennia, identify the exact same main culprit for biological collapse. Ayurveda warns us that losing mental clarity, losing your sattva, and falling into agitation and inertia, known as rajas and tamas, causes emotional and lifestyle imbalances. This is the root of physiological failure. And modern science? It completely agrees, just using different terminology. The HC model highlights chronic psychosocial stress as the key driver of modern non-communicable diseases, or NCDs. When your social and mental capital gets drained by chronic stress, your biological systems literally begin to collapse. Internal harmony is your primary defense against a harsh environment.
Which brings us to the real crux of this explainer. Section 5, Adapting Ancient Wisdom Today, the crucial translation. If the core concepts are identical, why do we even need the health capital model? Why not just, exclusively read ancient texts? Well, because the world has changed drastically, and our practice absolutely must adapt to it.
To build a complete picture here, we have to recognize the critical, necessary discrepancies in methodology. Take a look at the foundation. Ayurveda is built on a metaphysical foundation, this beautiful cosmology of 5 elements used as metaphors for biological processes. The HC model, it's empirical. It's grounded in modern epidemiological data and global burden of disease studies. Look at the focus. Ayurveda is highly individualized, treating your unique prakriti. But the HC model scales this up to be systemic, managing the stress of entire populations. And finally, the capital type, Ayurvedic capital, is your vital force, your prana. The HC model measures capital as a tangible social and cognitive metric. Basically, the HC model takes the incredible individual wisdom of Ayurveda and scales it up to combat modern, systemic, chronic diseases using hard, quantifiable data.
I absolutely love this quote from the source text. By adapting ancient wisdom to a changed world, the HCC seeks to address the systemic conditions that force populations into states of chronic stress. That hits the nail right on the head. This is exactly why this translation matters. Modern society has systemic, socio-psychological pressures that simply did not exist a few thousand years ago. We are being forced into states of chronic stress at a massive population level. We desperately need a scientific, systemic framework to apply this ancient wisdom effectively today.
So, what should you really take away from all this? Connecting these two models does a few incredible things. It provides historical validation, proving that treating health as an active, cumulative process isn't just some passing modern health fad. It proves health as an active process. It recovers perennial wisdom that we honestly kind of lost during the heavy over-medicalization of the 20th century. And most importantly, it establishes a global, universal truth. It's not just a Western epidemiological theory, and it's not just an Eastern metaphysical philosophy. It is a shared, universal human reality. So I'm going to leave you with this provocative thought. Look closely at your own life. Are your daily modern routines acting as deposits, or are they withdrawals in your vitality bank account? The ancient masters and the modern epidemiologists both agree on one massive thing. Your health is an active asset, and it is entirely up to you to invest in it. Thank you so much for joining me for this explainer, and I really hope this empowers you to actively manage your health stock starting today.